Hello and welcome back to the channel. I'm Dr. Kavipriya Soma, a general practitioner in Australia. So I get asked very often how to become a doctor or how to become a GP in Australia. Today we'll go through some of the steps to get to that process. Whether you are a student choosing the path of becoming a doctor or an overseas medical professional who wants to move to Australia and continue practicing as a doctor, some of these tips might help you. So we'll go through the 5 steps that is needed to get ahead in this process. So the very first step is getting your undergraduate medical degree. So that is, of course, without that, you cannot go any further. So that can be obtained either in Australia or from whichever country you're coming from. In Australia, there are 2 different pathways to get the medical degree. One is the undergraduate pathway, the other is the graduate pathway. So for the undergraduate pathway, what this means is that it's after you finish your high school, you get into medical university directly after writing the UCAT or UCAT examination. Whereas the graduate medical program is a program that you go into after you've completed a bachelor's degree. So if that is something that you want to do, then you give a different exam called GAMSAT or GAMSAT exam. You clear that and then get into medicine. So during your medical school training, you not only get theoretical knowledge, but also get hands-on clinical experience to take you further along and one step closer to becoming a doctor. And these placements are crucial because this will guide you to decide if general practice is right for you or not. So the second step is internship. Now, internship is quite different in every country. In Australia, you have to apply for internships once you complete your medical school. So after completing the medical degree, you will have to apply for internship, which is usually for 12 months or 1 year. So it's also called as a pre-vocational year. You will have lots of rotations through your internship: general surgery, medicine, emergency, pediatrics, or obstetrics and gynecology. Sometimes you get given a choice to choose the subjects to get a taste of what it is. Sometimes it is what is available in the particular hospital that you're applying the internship into. This is the time where your foundational skills are built, upon which you will start building your career further. And it is also a mandatory requirement to register with the Australia's registering body, which is ACRRM or APRA. So that's the third step, is registering with APRA. As just mentioned, once you've completed your internship, which is a requirement, then you can register as a general registration with APRA. But if you're an overseas trained doctor who's moved to Australia, then you may have to write your Australian Medical Council examinations to gain that registration with APRA, or you can have your degrees assessed through competent pathways through various colleges that you apply to, and that may henceforth lead to registration with APRA. We've just discussed about becoming a doctor, but if you want to become specifically a GP, if that's your interest, this is your 4th step that you need to know. So to become a GP, there are 2 colleges that offer these options for you: the Royal Australian College of General Practice and the Australian College of Rural Medicine, so RACGP and ACRRM. Both pathways lead to general practice, but the ACRRM is quite focused on rural and remote medicine, but RACGP also has special interest groups or rural generalist pathway. So that there are options available. Just wanted to let you know, if you have been following our channel, you would have listened to Dr. Ramya Raman's interview, who is the RACGP WA chair. So if you want to listen to that interview, please click on this link. So general practice training includes various components. Some of the components will be hospital-based training. There are some mandatory requirements for like pediatrics or emergency medicine if you're going to choose. But the other placements will be in the general practice setting, where you will have a supervisor that will be supervising you in the general practice, and that will lead on to your clinical experience. As with all medical colleges or medicine itself, there is exams that you have to clear. So there is exam support available as well, but the 2 components of the exam is again theory and OSCE, or practical exams. So once you have completed that, then you get the 5th step, which is getting your fellowship. So if you do the RACGP, you get fellow of the RACGP. If you do the ACRRM, then you get fellow of the ACRRM. It is important that you get that not only to practice as a general practitioner in Australia, but also to claim what we call Medicare rebates. So Medicare is the national health insurance that is provided by the Australian government. So once you have your fellowship, you can either go on to become a general practitioner per se, or you can work in the hospital care setting as well. You can work in the remote regions of Australia where the job can be quite satisfying. And also you can attract higher Medicare rebates with support from your Australian government. And as a GP, there are multiple groups where you can become GP with special interests like, say, skin cancer or women's health or cosmetics or emergency or cardiac or diabetes. So any of that is possible. In the upcoming videos, there will be also information regarding specialities that you can graduate into. So we've done the cruisy bit so far as to how to become a doctor in Australia or a GP in Australia. But there are challenges that this brings along the way. Some of the challenges, first things first, finances. So it's really important that you look into that. Either get family support or make sure you do have adequate finances before you move from another country. It can be hard during training. Now, because of that can put pressure on your psychological health or mental strain can happen. So it's really important that you build your support network. Balancing study, work, and home is really, really important. I don't think that is exclusive only to doctors in Australia. It's all over the world. Balancing act is very, very difficult. But if you find that niche, you're lucky. So there you go. These are some of the steps to becoming a general practitioner in Australia, but also looking after yourself. If you would like more information, drop a comment so we can get back to you as well. Or if you are somebody who's seeking psychological support while training, please drop a comment as well. We might be able to help you or point you in the right direction. So all the best with your career journey.